Well, I've been doing studies of the health effects of air pollution on, the effects of air pollution on human health for many years. And certainly air pollution from power plants, and especially coal-fired power plants, are included in that. And what we found is that air pollution has a big effect on health, adverse effects, including from increasing hospital admissions and asthma attacks, days of school and days of work missed, and even to the point of increasing the numbers of deaths in the United States and around the world. I was involved with the global burden of disease, and you were talking about something like 3 million deaths per year worldwide from air pollution each year. So, and a big part of that is coal burning as a source of air pollution, and the pollution from coal is among the most toxic.
And why is it the most toxic? Maybe you can help people to understand that.
The fossil fuel combustion particles really are among the most toxic, and the things that are in the particles from fossil fuel combustion are in the highest concentration in coal particles. The pollution coming out of coal, like arsenic, lead, selenium, all these trace elements, metals, as well as sulfur oxides, which form sulfuric acid and make the particles more toxic. So it's a very dangerous mix that comes out of coal-fired power plants, the other fossil fuels also, have some of the same constituents, but at much lower concentrations. So that coal is really thought to be the most toxic of the fossil fuel combustion particles, and those fossil fuel combustion particles are among the worst of health. So part of it is the composition, and the other part is that because they're combustion, they're very, very small particles. And so that they, if you have natural particles like windblown dust, your body can defend against that by you capture it in your nose or your throat, and you'll swallow it or cough it out or sneeze it out. But these combustion particles are far smaller than that, and they defeat the body's defenses and can enter the lung and get into the bloodstream and affect the body much more effectively, as it were, than the kind of pollution that our species is sort of used to being exposed to over in the past. So our defenses don't work against them. So they're very toxic, and we have no defense against them.
So explaining this to individuals who say, well, we're all healthy, we've been living by the plant our lives, we're fine. Why is that? How can they say that then?
Well, there's no control factor there. In other words, they would be healthier if they weren't near the plant, but it's hard to say, you'd need to have like twins, where one twin lived near the plant and the other twin lived far away, and you'd see the difference. I've had experiences sort of like that with going back to my high school reunion, and there were twins in my class, and the one who lived in Florida, and there was one who lived in Philadelphia. The one who was in Florida was out in the sun all the time, and her skin was completely different from, the sister who didn't get exposed to all that sun. So you could see the comparison. But in this case, the person's there. They would be likely healthier than if they weren't exposed. But you can't really adjust for that. And there's a lot of factors that affect your health, and this is just one. So this air pollution increases your risk of having adverse health effects that you might have anyway, but it just increases your risk. So it's hard to, on the individual level, it's really impossible to pick out.
Is there a way to, the data and the research that you're doing to make it specific to certain areas? Especially in the Navajo Reservation, where you also have Hopi people living. I was at a hearing up at Hopi, and
last night,
and there were statements made about this is just one plant. The reservation is actually surrounded by 7 power plants, and yet there's no health studies. They claim there's no health data. Is that it's not being collected? There's no law that says you need to collect this? Because, I mean, you're talking about something very dangerous.
Right. Well, I mean, I think that one of the challenges we've had, I mean, some of the early studies that I did, I went to Canada to do because they had national health care. So they had a system of collecting doctor's visits and hospital admissions and things like that. So I went up and analyzed their data with air pollution. And the United States, we're just playing catch up now. And we're starting to get national health care where there'll be more national information so that you could aggregate that and collect that. But it's not going to be, even at that, I doubt it will be as extensive as what they have in Canada. So this is a challenge not only in the Navajo Nation, it's a challenge everywhere to get these data to do a study in one particular locale. A lot of times we end up going where they've collected the data and have it available, like New York State, California historically have aggregated these data so we can analyze them. And so we're looking under the lamppost. And if those data are not collected on a routine basis, then you have to fund a complete study to go out and collect the information and gather it. And that gets to be very expensive. So I think that might be part of the reason why.
Would there be a difference in when you talk about gathering the data? Because one of the individuals who made a comment, public comment to the U.S. EPA, said that the population on the reservation, Navajo, Hopi, and even there's like San Juan Indians that live there, that it's very different from the non-Indian population because we're very, he called it landlocked. The people aren't mobile like off reservation. That is our traditional homeland, and sometimes that's not taken into account as far as the importance of why you have a certain group of people, and even that term environmental justice being used by these people now, by Hopi, Navajo, in that area, and saying, we don't go anywhere. So it's like you have a group of people that aren't moving around like you have maybe perhaps like Detroit or wherever they have these huge power plants.
Well, actually, that's a plus in terms of trying to study it. Because, for example, we did a study of children in Connecticut, and it was an asthma camp run by the American Lung Association. They bring the kids in for a week, and they're all right in the same location for a whole week. And we did this 3 summers in a row, and you can, because they're all in one place, it's much easier to monitor what their exposures are because they're all together. Now, if they were traveling off in cars and going to schools and going shopping and things like that, then you wouldn't know what their exposures were. So in a way, that would be an advantage in trying to do a study of it at any rate, that the population, if it's not as mobile, especially, for example, young people probably don't have jobs, so they're not driving places.
Well, it's not even that. It's just that for me, my mom comes from a place called Lake Valley, so I could trace where her mom was at, my great-great-grandmother. I mean, we live in one area. That's where we've always lived. And then you have people that were testifying saying, I live over here at this mountain. My family have always lived there. And we understand that. I mean, they have ceremonial grounds. There's this really strong connection to the earth that Navajo, Hopi, and the San Juan people have.
Well,
so it's not even connected to jobs or anything. It's just that even if you get a job off a reservation or you go to college off a reservation, you come home and then you build your home there. Like if my daughter got married, she would have her home near mine, and that's why you see clusters of housing in some of those areas.
Sounds wonderful, but for a family.
So that's what I was talking about, data collection.
But in terms of data collection, it actually makes it easier because you can get a lifetime record. Because in the United States, everybody travels around and moves from state to state and gets new jobs and everything, and that makes my job very difficult because I have to know where they were and figure out what the exposures were and that kind of thing. Whereas in this case, it actually would help strengthen such a study. So I can see that as an advantage to trying to study the problem, and that you would know where people were, what their exposures were, and then you could study it more readily.
And is there a population that's more susceptible than perhaps by age or pregnant women or children?
Oh yeah, there's definitely a very variable nature of susceptibility. And so there are susceptible groups, especially the very young and the very old, and especially people with pre-existing diseases. If they have a cardiac problem, then they're more likely to have a very serious impact of air pollution, because they're sort of closer to the ledge of having a problem, and pollution sort of gives them that extra shove and then can actually create a much more severe situation. And so there's a lot of variability. One of the big concerns now that people are studying more and more is exposures to pregnant women and neonatal children, that's a very sensitive time, and that they're finding more and more effects where pregnant mothers are exposed, and then their effects on their children, and also once they're born having exposure. So that is a very important developmental period, and so people are studying that more and more and finding adverse effects. So there definitely are people who are much more susceptible. Everyone is affected by air pollution, but these people who are sort of more threatened already, their health is already threatened, then it has a much bigger impact. It can make a much bigger influence on their health.
Thank you for your time, and we're getting started here.
Yes. Okay.